Good afternoon and welcome to the 2020 virtual annual meeting of the New Hampshire Hospital Association and the Foundation for Healthy Communities, a celebration of our healthcare heroes. I'm Bob Stegmeyer, the President and CEO of Concord Hospital, and I've had the privilege of serving as chairman of the New Hampshire Hospital Association Board of Trustees this past year. And what a year it's been. We would normally be gathering up at the Mount Washington for our annual meeting to hear compelling presentations from healthcare executives and thought leaders from around the country, and to celebrate key leaders in our state and reconnect with one another to share many challenges and opportunities facing us here in the Granite State. But in the understatement of a lifetime, this year has been like no other. The COVID-19 pandemic has upended our society and economy, challenged our healthcare systems to respond like never before, and changed the lives of far too many people here in New Hampshire, around the country, and across the globe. Despite all of those challenges, we are gathering today through the New Hampshire Hospital Association and Foundation for Healthy Communities, albeit in a different format, with hope, optimism, and a greater resolve than ever before to lean in to the COVID-19 pandemic and keep our patients, staff, and communities safe and healthy. It's what we're all called to do. It's why we answered this calling to serve others. I could not be more proud of the women and men who have come to our hospitals and healthcare systems every day over the past 8 months to care for their patients, actually rushing into the front lines in the face of the pandemic, to serve the patients and communities who depend on them to be there when they're needed most. And it is those heroes that we want to thank and celebrate today. I also want to thank my colleagues from across the state who have been committed to working together to address the challenges we are all thrown back into in early March. We are all working to address the challenges in our institutions, from redesigning systems to ensure safe care for patients with and without COVID-19, acquiring the personal protective equipment we need to do just that, increasing and setting up testing capability and capacity, and managing the huge financial losses our organizations have endured as a result of shutting down non-urgent elective procedures earlier this year. But we haven't been on this journey alone. The outpouring of support from our communities has been overwhelming and absolutely heartwarming, a testament to our hospitals and what they mean to every single person in the state of New Hampshire. From Boy Scouts and children collecting and making gifts and signs of gratitude, to individuals donating thousands of homemade face coverings, to small and large companies alike delivering much-needed PPE just when we needed it the most. And as healthcare leaders, it is a journey we've been on together, with each other and through the leadership of the New Hampshire Hospital Association. As I shared with the NHHA board at our meeting back in June, we are so very fortunate that the Hospital Association has been working with us in partnership to organize around shared concerns, to gather information and metrics that help us and state leaders make decisions, to respond to the pandemic, and to help inform policymakers and the public about the challenges facing hospitals and what we need to be doing together in the days and months ahead. I want to take this opportunity to thank our president, Steve Annan, and the entire team of the association and the Foundation for Healthy Communities for their efforts over these past 8 months. We indeed are so grateful for the leadership and the commitment you and your team have shown to engage and inform our members, as well as to mobilize us for action in partnership and collaboration with one another, our state leaders and our congressional delegation. While it is always our goal and operating model to work together through the association, this pandemic has demonstrated the value of doing just that. And while we have many challenges in the days ahead, I'm confident in our ability to overcome those challenges and ensure the continuity of delivering high-quality healthcare services to our patients and communities. It's been a privilege to serve you as your chairman this past year, and I look forward to continuing my involvement with the association and all of you in the years ahead. Before we begin, I'd like to take a moment to thank our sponsors of the 2020 annual meeting for their continued partnership and support of the Foundation, the Hospital Association, and its members. Our endorsed partners include Commerce Healthcare, DCI Solutions, Healthcare Workforce Logistics, Hospital Careers, Jackson Physician Search, Managed Care Advisory Group, Medical Solutions, Performance Healthcare Solutions, and Vista Staffing Solutions. And our sponsors, AARP New Hampshire, Bank of America Merrill Lynch, Barry Dunn, the Business and Industry Association of New Hampshire, Coveris, Delta Dental, Exact Sciences, Guidehouse, Harvard Pilgrim Healthcare, Hinckley Allen, Jackson Lewis, Jennings Healthcare Marketing, McLean Middleton GPS, New Hampshire Healthy Families, Nixon Peabody, Orrin Reno, Santa Fe Pasteur, TD Bank, and WellSense Health Plan. We are grateful for your support and look forward to being together next year in person. And now I'd like to introduce our president, Steve Annan, to introduce our keynote speaker today. Steve?
Thanks, Bob. And thank you for your leadership this past year as chair of the NHHA Board of Trustees. As you said, this past year has been like no other, but I'm so thankful for all you've done to help lead the association during these challenging times. Even with the heightened responsibilities of leading your own organization during the pandemic, you were always available to help me and our team as we worked through so many challenging issues. Sometimes that meant connecting at odd hours of the day or night, or even on weekends, but you were always there and we couldn't be more grateful. Your advice, counsel, and support were so very much appreciated. It is now my pleasure to introduce our keynote speaker, Dr. Melinda Estes, President and CEO of St. Luke's Health System in Kansas City and the current chair of the American Hospital Association's Board of Trustees. Dr. Estes is a board-certified neurologist and neuropathologist who's no stranger to New England, having served as president and CEO of Fletcher Allen Healthcare in Burlington, Vermont, before being named to lead the Baldrige Award-winning St. Luke's Health System. We're so pleased that Dr. Estes can be with us today by satellite. She was slated to join us up at the Mount Washington until COVID-19 got in the way, but the perspectives and insights from her role as chair of the HA Board of Trustees are more impactful today than ever before. Now, as many of you know, I served on the AHA executive management team for many years before coming to New Hampshire, but I'm also a native of Kansas City. And Dr. Estes and her team have been so important to me and to my family as they provided great care to my parents over the past several years. So this is a very special introduction for me. Thank you for the great care St. Luke's has provided to them and to all in your community. Please join me in welcoming the chair of the American Hospital Association Board of Trustees, Dr. Melinda Estes.
Good afternoon, everyone. I'm pleased to be with you today, and thank you, Steve, for your warm welcome. I really would rather be there in person because a New England fall is always a very special time of year. As we both serve in these roles during this tumultuous year, Steve, I know that you and I, and really everyone joining us today, share the important responsibility of not only leading through this crisis, but also of ensuring that we keep our eyes forward, always planning for what's to come next. And that's where I think we really find true value for meetings like this. And I want to thank you, Steve, as NHHA president, and Peter Ames of the Foundation for Healthy Communities for co-hosting today's events and remaining committed to our mission of excellence in health. Because, the weeks and months of this COVID crisis have really lumbered on. They all blend together. We see the clear toll that the pandemic has taken on our local communities and how it has uniquely affected our hospitals and health systems and our people on the front lines. And in coming together like this, we have the opportunity to not only find common ground, but to craft solutions for our most pressing shared problems. Like the fact that right there in your state, more than 9,600 of you have contracted the virus, and 466 of your New Hampshire neighbors have lost their lives to it. Here in the bi-state Kansas City metro area alone, we've already surpassed that number with more than 650 deaths. And as schools have reopened, both Missouri and Kansas are both now alarmingly experiencing uncontrolled spread of the virus. The damage and lasting effects in our lives is clear and evident, whether we're talking about the devastating casualties there or here, or in your neighboring state of Vermont, where I spent 8 years with Fletcher Allen Healthcare, now the University of Vermont Health System, leading a team that provided exceptional care and really learning a little bit about the New England spirit. A spirit that is embodied in New Hampshire resident Jerry Shuppel, who, as you no doubt know, not only recovered from the Spanish flu in Massachusetts in 1918, and then survived 2 bouts with cancer in the 1980s, but then, at the age of 102, beat COVID in March in Nashua. That's a classic New Hampshire story, a classic New England story, a resilient and fighting spirit filled with purpose and a drive to keep going through the toughest of challenges, through the harshest of winters, working toward spring. Today, as we round the final stretch of this unrelenting year into the certainty of harsh winter ahead and through to a hopeful spring, we in healthcare all see the immense work that still lies ahead. Not just with COVID, which we know will remain with us for the foreseeable future, but also with the critical public health issues that were already plaguing our American communities before COVID, like the opioid epidemic and a national mental health crisis, now made worse by months of isolation and growing anxiety about the state of the world. This, I know, is what is on Steve and Don Caruso's minds as they look to 2021 and the ways that NHHA can and will continue to serve the needs of New Hampshire, just as we continue to do at the American Hospital Association. Fight for the things you care about, the late Justice Ruth Bader Ginsburg said, but do it in a way that will lead others to join you. This, I believe, is the essential role that AHA is playing throughout the pandemic. And in that role, we have made tremendous progress. As an active board member for over a decade, I've served alongside some of the field's best leaders, like your own Dr. Joanne Conroy, President and CEO of Dartmouth-Hitchcock Health in Lebanon, and with the dedicated staff of the AHA. Time and again, I've seen the extensive work being done on behalf of our member hospitals and health systems. But during this pandemic, it has been truly remarkable. As we've all been managing the on-the-ground effects of COVID, the national network of AHA support has been simultaneously at work in DC, advocating on our behalf and staying focused on the 3 R's of relief, recovery, rebuilding, and reimagining, all to help us get through this crisis and on to a better, healthier, and safer post-COVID world. In addition, we're also now applying focused attention and resources to 3 critical issues. They were with us before the pandemic, but the pandemic has shone a bright light on them: resilience, behavioral health, and health equity. Earlier this year, with AHA as our advocate, American hospitals were deeply relieved to see the passage of the $2.2 trillion CARES Act, which included $150 billion of funding and resources for hospitals and health systems and providers on everything from COVID testing, rural health support, and enhanced telehealth services, just to name a few. But now, knowing we're nowhere near the end of this crisis, our urgent and ongoing appeal for additional relief is more pressing than ever. So we're back at it, trying very hard to pass in a timely manner a COVID-4 bill, for lack of a better term. We will see what happens. Tomorrow is the stated deadline, so hopefully we will see some movement on a new stimulus. Of course, the AHA doesn't stop at making requests. We're also making progress. Over the past several months, it's been my honor to lead the AHA task force charged with developing the carefully researched guidance for our members on how to reopen safely. The resulting Pathways to Recovery resource, available to download at AHA.org, helps our members by providing expert guidance and best practices from organizations around the country. In the critical area of supply chain, the AHA's Association for Healthcare Resource and Materials Management helps ensure our frontline staff are protecting others and protected from the many risks around them through an ample supply of quality PPE. With the launch of the $100 million mask campaign in March, the AHA urged manufacturers to increase production and distribution of PPE to our healthcare workers. And it has worked, galvanizing private businesses and individuals and dramatically increasing our supply of PPE for frontline workers in need across the country. We've turned from PPE and testing and staffing, which in my mind have been the three constants of this pandemic, and added a fourth, which is now vaccine. With more than 150 potential vaccines in development, I know you all join AHA in eagerly awaiting the day that we can work together to begin the promising work of vaccinating our nation of more than 300 million. The AHA's vaccine group is working with the Institute of Medicine, as well as HHS, FDA, and CDC, working on issues of science, distribution, logistics of vaccinating, reimbursement, and equity of vaccination. But the fair distribution of a COVID vaccine is really not the end of our work. It extends into the care we provide on a host of health and wellness issues, through clinical excellence inside our hospitals and through non-medical interventions outside our walls, in the streets and homes of our neighboring communities, the ones that are truly hurting and in need of both compassionate and equitable care. More than 1,600 AHA member hospitals have taken the 1, 2, 3 for Equity pledge with a three-part goal to increase the collection and use of race, ethnicity, and language preference data, to increase cultural competency training, and to increase diversity in governance and leadership. While this has been a focus by AHA for the last 5 years, COVID has brought a renewed urgency to the stark realities of health disparities by race. And with that, the Health Equity Roadmap was created, a framework designed to help hospitals chart their course toward health equity. The Equity Roadmap helps identify both best practices and areas in need of improvement. It has carefully curated tools and resources, virtual learning networks, and certified coaches. The roadmap is intended to provide constant support for all hospitals as they make their way along the journey toward equity. This will be available in early 2021. It recognizes that achieving health equity is a process, and all of us have to start somewhere. And the desire of the roadmap is really to meet us where we are. None of this, of course, is easy, not as healthcare providers, as professionals, not as everyday people. Even before COVID, research showed that nearly half of all US physicians were experiencing symptoms of burnout or emotional exhaustion. But that's not because physicians are simply wired that way. In fact, according to a recent study from researchers at the Mayo Clinic, physicians on average exhibited higher levels of resilience than other working populations. But still, burnout rates were substantial, even among the most resilient. The solution? Support, intervention, a clinical care environment that puts provider well-being first, that champions wellness, purpose, and balance. A system that shows as much compassion to its care provider teams as it does to its patients. And I'm proud of the work of the AHA's Physician Alliance that is tackling these issues head on. It continues to be a focus for the American Hospital Association. As we look back over 2020, unprecedented is the word we've heard time and again. The pandemic, the recession, the election, the natural disasters. This year in its totality, unprecedented. But so is the work being done by this field of experts and skilled providers. So is the level of compassion and heroic sacrifice being offered daily in hospitals in New Hampshire, Missouri, Kansas, and every state in between and beyond. So thank you again for your heroism, for the work of all of your frontline providers, for all that you're doing, and for the individual accomplishments that are helping us reach a hopeful, better, and reimagined new normal. It's really been a pleasure to be with you. Thank you again.
Thank you, Dr. Estes, and thank you to the AHA for all that you are doing to help hospitals in New Hampshire and across the country. Just one question. As chair of the AHA this past year, you've had the opportunity to interact with and see healthcare leaders from all across the country adapt to and tackle head-on the COVID-19 pandemic. Can you share your perspective on not only what organizations have done to successfully respond to the pandemic today, but that will also help propel them moving forward?
Thank you, Steve. It's a great question. And if you had asked me would I have interacted with all of my colleagues across the country this year, mostly virtually, I would have told you no way. But I have been on almost every virtual platform there is. I am a master of none, but I've still been able to travel the country. One thing that has really struck me is the fact that as this pandemic began to unfold in the February timeframe, all of us stood up, our incident management teams began to contemplate what this would mean for us. This is an uncharted waters, an unknown world. We knew very little about this novel coronavirus at that time, but we did what we've always done as providers. We were always there, we're ready to care, we stepped in, and we didn't miss a beat. And that has certainly been something that I have seen across the country as I have interacted with people. The willingness to jump into the unknown of the front lines, to take care of people as we have always been charged to do, and really a rededication of so many providers to doing just that. You know, the other thing that has struck me is the ability to make decisions without having complete information. Leadership in this time of crisis really needs to be flexible. It needs to be nimble and fluid in decision-making, and being able to constantly course correct as the crisis dictates. And we certainly have seen a rolling crisis across the country. And now we're seeing, waves. I don't know if this wave is wave 2 or wave 3, but we continue to see COVID. We have more COVID cases in Kansas City now than we've had at any time this year. In moving forward, I think there are a number of lessons. I once had a boss who talked about making lemonade out of lemons, and I think the pandemic perhaps is a good example of that. We have done a number of things relatively quickly that we were surprised we could do, telehealth being one. Across the country, people have gone from 0 or single-digit telehealth visits upwards of 30, 40, 50% of telehealth visits with good adoption both by providers as well as patients. Folks have talked about listening, not just to respond, but really trying to understand. I think transparent communication, and lots of it, has never been more important than now, and an authenticity of that communication. And then finally, I would just say, we at St. Luke's, like all of you in New Hampshire, multitasking is key. The pandemic is front and center, but nonetheless, we have lots of other pressing issues and lots of other folks who need care. And I talk about taking care of COVID patients and taking care of everyone else. And I've seen my colleagues across the country do that as well.
Great. Thank you so much, Dr. Estes, for joining us today, for sharing your thoughts and perspectives with us. We're so grateful that you will be able to join us in person at our annual meeting next year up at the beautiful Mount Washington Resort.
I look forward to it. Thank you.
And now it is my distinct privilege and opportunity to introduce this next segment of our meeting to honor and thank all of the healthcare heroes who have been and continue to be on the front lines of the COVID-19 pandemic. While it's impossible to capture in one video all of the skill, compassion, and dedication to patients that each of you bring to the work that you do, I'm hopeful that this video resonates with you. The comments of gratitude throughout the video by key leaders here in New Hampshire are true testaments of your efforts, which have not only been noticed, but are incredibly appreciated by citizens all across the Granite State. You know, we often talk about the important role that hospitals play in their communities every day, and you have demonstrated time and again throughout this pandemic and countless challenges before your commitment to being there, prepared to care for all of your patients when they need it most. It is the honor and privilege of a lifetime that we get to stand with you and work alongside of you in the noble work that you do. Thank you. Thank you for all that you do. I hope you enjoy this video.
Hi, this is Governor Chris Sununu. I wanted to take a moment and say thank you to all of New Hampshire's frontline healthcare workers. You've been on those front lines, keeping New Hampshire communities safe and strong as we've confronted the COVID-19 pandemic. In the past few months, we've faced unimaginable challenges, but without question or hesitation, you've stepped up. Your passion for serving our state comes at no surprise because it's that commitment I've had the honor of watching you devote yourselves to over the past few years. Whether it's been rebuilding our mental health system, standing up our new Doorways program, or just taking care of our senior citizens, you're always there. On behalf of every Granite Stater, it's my honor to thank you for the work that you do. Stay strong, be healthy.
Hi, I'm Lori Shivanet, and I'm the Commissioner of Health and Human Services. I have never been so proud to be a nurse as I am right now. Back in March, I had only been commissioner for a couple of weeks before COVID spread fear all throughout New Hampshire. When we needed people to step up, you were brave. And when we needed care, you were there and you were compassionate. And when we had the option of staying home and working remotely, you went to work every single day and took care of the citizens of this state. DHHS wants to thank you for all that you've done with keeping the citizens of New Hampshire healthy and safe through COVID-19.
Thank you for this opportunity to express my deep appreciation to all of our healthcare heroes. We can't thank you enough for everything you're doing and for all the sacrifices you've made this year. We're always grateful for your work, but this year you've gone above and beyond. I know these have been incredibly difficult times. There's been enormous stress, extra shifts, new procedures and safety measures, and the heartbreaking loss of patients to COVID-19. You've put your lives on the line to treat others. All of this in addition to taking care of your own families. The financial challenges that so many of our hospitals are facing have led to furloughs, exactly what we don't need during a pandemic. It all takes a tremendous toll, and we owe you all an incredible debt. Sadly, even as our nation has passed 200,000 deaths, we still have so much more work to do to get through this pandemic. I'll continue to do all that I can to make sure you have the resources that you need. I will not stop fighting for you because I know how hard you're fighting each and every day to save lives. God bless you, stay safe, and know that New Hampshire is so incredibly grateful for your heroism.
Hello, I'm Senator Maggie Hassan. I'm sorry that we aren't gathering together in person, but thank you to the New Hampshire Hospital Association for hosting this virtual celebration of our healthcare heroes. We cannot thank healthcare workers enough for what you do every day. That's especially true during this pandemic. From the outset of this crisis, you faced a new deadly disease with bravery, kindness, and professionalism, always putting your patients first. And despite the emotional and physical toll that being on the front line takes, you've persisted and you have led. Our state and our entire country owes you and your families our thanks and appreciation. But more importantly, we must do everything that we can to ensure that you have the resources that you need. I'll keep working with Democrats and Republicans in Congress to provide that support. Thank you again for all that you have done and will continue to do. Please stay safe.
Good afternoon, and thank you to the New Hampshire Hospital Association and the Foundation for Healthy Communities for inviting me to speak with you during the 2020 Virtual Healthcare Heroes Celebration. First and foremost, I want to thank our healthcare heroes, our doctors, nurses, EMTs, home health aides, first responders, and all our unsung heroes during 2020. We are forever grateful to you. As we did our part to stay home and slow the spread of the coronavirus, you selflessly went to work each day on the front lines of the pandemic to care for patients, stand in for family who are unable to be with their loved ones, and do your job in the field during an unprecedented time. While there is no way to adequately thank you for all that you have done, please know that I will continue to be a champion for Granite State's healthcare providers, rural health systems, hospitals, community health centers, and home health services through my work on your behalf in Congress. I look forward to our continued work together, and on behalf of my constituents across New Hampshire's 2nd Congressional District, we are forever grateful to you.
Hi everyone, I'm Congressman Chris Pappas. I'm pleased to be joining you for the New Hampshire Hospital Association's virtual celebration of New Hampshire's healthcare heroes. The healthcare community in New Hampshire has not been tested like this in a generation. The COVID-19 pandemic has put an unimaginable strain on our hospitals, our entire healthcare system, and most of all, our healthcare workers. You have been on the front lines of this pandemic since day one, going above and beyond what any of us could have imagined necessary or even possible. Thanks to your selfless work and dedication, more Granite Staters are alive today and staying healthy. But this has not come without a price. We've lost far too many doctors and nurses and support staff, and that's a burden we will always carry. The way you have worked together and risen to meet this moment is truly inspirational. Our federal congressional delegation has fought to provide resources for our hospitals and our frontline workers, including those in the most rural communities in New Hampshire. And we'll continue to work with you every day to help get the support you need and deserve. The stories of what ordinary Granite Staters and frontline workers have done to meet this challenge, courage and optimism and grit, provide a much-needed ray of hope at this dark time. I think about the nurse in Manchester who, after working a full shift, met with friends to make their own PPE to keep themselves and their colleagues safe. I think of the doctors in Dover who worked to transition to telehealth to continue to provide care to patients while remaining socially distant. And I think of the Bedford Sewing Battalion, a group of concerned citizens who took it upon themselves to sew masks for New Hampshire hospitals in their time of need. If this pandemic has taught us anything, it's taught us that we're all in this together. And while we may be socially distant, we are closer than ever before. And we will come out of this stronger and healthier than ever because of the work and dedication of our hospitals, our providers, and our healthcare workers right here in New Hampshire. So thank you to New Hampshire healthcare heroes for all you have done and continue to do. We owe you a tremendous debt of gratitude, and I hope everyone stays safe.
Hello, I'm Donna Soucy, President of the New Hampshire State Senate, and I'm thrilled to be here with you for this celebration of our hospital heroes. At any given time, any one of us may need the services of our healthcare institutions. And certainly in the past few months, we have learned more than ever just how important each and every one of these institutions, hospitals, healthcare facilities are to our communities and to our families. And in this extraordinary time during this pandemic, there's no question that those of you here in New Hampshire are truly heroes and have truly risen to the occasion, not just by showing up and doing your job, but by sacrificing your own health and that of your family, by going the extra mile to be there for those people who couldn't be with their families, who were suffering and who were experiencing not only health issues, but loneliness and fear. It is critical that we take time to recognize the important work that you do each and every day. Thank you to all of you in all of our hospitals and our institutions throughout the state. We are truly indebted. We know we are not out of this situation yet, We know there's more to do. But from the bottom of my heart, thanks to each and every one of you for making sure that our families are better and healthier and feel a little more secure as a result of the great work that all of you do. Thanks again, and have a great virtual celebration.
Thank you for the opportunity to say hi to you tonight. I certainly want to thank Steve Arnon, his staff, the members of the board of directors, all the members of the Hospital Association for everything they're doing in the state of New Hampshire. We are going through some trying times, and we've done that in the past. And what I can tell you is this legislature knows it can count on the New Hampshire Hospital Association to work with us to make sure we deliver health care to each and every citizen in the state of New Hampshire. During these pandemic times, you have made it very clear that you're going to participate with us here at the State House, and we're going to accomplish great things. I look forward to accomplishing even more in the future. I certainly look forward to working with Steve and Joel. At times you're entertaining, at times you're the best knowledge for healthcare in the state of New Hampshire. I truly enjoy working with you. I look forward to a strong future.
My name is Steve Shurtleff, and I have the honor of serving as the Speaker of the New Hampshire House of Representatives. And on behalf of the New Hampshire House in general, but for myself personally, I want to welcome you all to your virtual celebration. The people of New Hampshire owe a great deal to those healthcare professionals that are working at our hospitals all over the Granite State. As someone was just telling me recently, it's such a wonderful job that our healthcare workers in the hospitals have done to serve as a proxy for families who can't visit their loved ones, especially at the time when their time on this earth is limited and they're about to pass on. It's the healthcare professionals who are there to hold their hands and to give them comfort. And as I said, to act as a proxy for the families who are grieving. I heard a story years ago, and it told about after the Battle of Wellington defeated the French at the Battle of Waterloo in June of 1815. King George had a special medal struck for the soldiers who fought at Waterloo. And it was called the Waterloo Medal. It was made of silver and had a blue and red ribbon attached to it. And the people of England celebrated those who served in that very decisive battle. And they tell the story in the 1840s, an old man was arrested for vagrancy in London, and he was brought before a magistrate at the Old Bailey. And as this dirty old man dressed in rags stood before the judge said to him, "Before I send you to the workhouse for 60 days for vagrancy, do you have anything to say in your defense?" And this old man stood standing just a little bit taller, reached into the lining of his coat and pulled out his silver Waterloo medal. And he said, "Your Lordship, I have but one thing to say. I was with Wellington at Waterloo." And no matter how tough life had gotten for this old man, he would never pawn or sell his Waterloo medal. And the judge, with tears in his eyes, said, "Dismiss the charges against this man and set him free." I know that our healthcare professionals all across the Granite State in days to come will be able to say with great pride, "I served as a healthcare professional during the great pandemic." And again, they'll have the gratitude and the respect of everyone in the state and across the country. Thank you all, and God bless you all for the wonderful work you do, and have a wonderful celebration.
Yes, good afternoon. This is House Republican Leader Dick Hinch. I just want to express our heartfelt gratitude for all of the hard work that you have done to keep us safe and secure. We really appreciate all of your support and the tireless hours that you put into this. So again, best wishes to you all, and thank you very much.
As the New Hampshire Hospital Association and your 26-member hospitals gather for your annual conference, I want to take this opportunity to thank you for your extraordinary leadership and your selfless service to all of the citizens of New Hampshire. Your frontline health care workers, administrators at hospitals, the staff of the New Hampshire Hospital Association, you folks have just done an extraordinary job, along with Governor Sununu and state employees that you have partnered with over the last 6 months. New Hampshire has had a difficult time during the pandemic, but because of your leadership, your willingness to treat so many people, preserving hospital capacity, administering tests, getting PPP out to people that need the protective gear. I just want to again say thank you. As a past recipient of the Hospital Association James Founders Award, I actually think you should nominate all of your frontline healthcare workers, your staff, your administrators, and the Hospital Association for that award, because your service to New Hampshire has truly been extraordinary. Thank you again.
What an amazing tribute to our healthcare heroes in recognition of all that we've done to respond to COVID-19 pandemic on behalf of our patients and communities. I think the video testaments speak for themselves, but the images speak volumes as they demonstrate your commitment to your patients and colleagues, your resiliency during the most challenging public health crisis we have ever faced, your strength in carrying out your institutions through these unprecedented times. As New Hampshire healthcare heroes, you have served as symbols of health, healing, and hope. And for that, we couldn't be more grateful for your dedication or more inspired by your bravery and compassion. To all of those on the front lines every day, we thank you for everything you do from the bottom of our heart. And now, I have the pleasure of introducing our guest speaker, Dr. Thomas Balsasek, who will provide us with an update on the development of plans for what we hope will be an effective COVID-19 vaccine and what we can anticipate as the pandemic continues. I know that is something all of us are working on in our healthcare systems, and I'm sure Dr. Balsasek will have key insights for us from their experience in his own organization. Dr. Balsasek is the Executive Vice President and Chief Clinical Officer at Yale New Haven Health in Connecticut, an Associate Clinical Professor of Medicine and lecturer in public health at the Yale School of Medicine. He's a board-certified internist and fellow of the American College of Physicians and the American College of Healthcare Executives. Please join me in welcoming Dr. Thomas Balsasek. Dr. Balsasek?
Hi, can everyone hear me okay? Good. So thank you very much for this invitation, and congratulations to you all. That was a very inspirational video that we just saw, and I add my congratulations to your elected officials. So when you all contacted me to talk about vaccine development, I gave you the caveat that I'm not a scientific expert, and I'm primarily an administrator and internist. And I'm going to try to tailor my remarks to how we're thinking about the vaccine development and how we might approach mass vaccination in Connecticut and in our health system. And I'll spend just a couple of minutes talking about how we've experienced COVID-19, and I'm sure a lot of the lessons we've had resonate with everything that you have experienced and continue to experience. Can I have the next slide, please? So just an introduction to us as an institution in the next slide, if I could have that. Thank you. Like most of you, I'm sure, we have a mission, vision, and values that we live every day. And I just want to bring into focus our vision to become partners with more institutions around us. Because as a health system, while we have about 8,000 medical staff, 2,500 beds across the lower section of Connecticut and into New York and Rhode Island, and we see about 180,000 inpatients and 3 million outpatients a year, we are increasingly partnering with others that share our values to extend our footprint across Connecticut and beyond. And I think the vaccine development in our partnership in all of our clinical trials, even especially during the COVID-19 pandemic, have demonstrated how that part of our vision to work with others that share our values is so important. So right now we're currently involved in one vaccine trial with Pfizer, and I'm going to get into that particular vaccine in a second. But again, I think that's an important part of our vision. Can I have the next slide, please? Everyone has their COVID-19 story, and this is our health system's story in a nutshell. We opened our system incident command structure back on February 9th, and then we received our first patient on March 8th. And you can see we very quickly ramped up at the peak of the pandemic on April 21st for us. We had a total of 800 patients in our hospital. That's the top line. And then you can see below the number of patients that were in our ICU and the patients that were ventilated in our ICUs. So we are now, as you can see by the tail end of this graph, we are starting to see an uptick in patients. This slide is a couple days old. As of today, we are back up to 83 patients across our health system that are in-house right now. We're concerned about, as I think the rest of the United States is in the uptick of cases, and we're really starting to see in our communities COVID fatigue. You see it with outbreaks in our schools, and unfortunately those outbreaks in our schools and universities are extending to our communities and vice versa. So we're watching this very carefully, and we all know that beyond the basic public health measures of social distancing, mask wearing, and hand hygiene, what's really going to solve this pandemic is going to be a vaccine with development of community immunity. And I think everyone knows from the popular press that community immunity really only exists when you get upwards of 80% of the population successfully immunized. And that represents, I think, for us, a huge hill to climb, because merely getting that percentage of population vaccinated represents a challenge. But as famously said by the FDA back in February, is that they will be willing to approve a vaccine through an emergency use authorization, or EUA, when there's a vaccine maker that can demonstrate at least 50% efficacy. So even if we're able to get 100% of folks effectively vaccinated, that only means that about 50% will be protected. That might be enough to stop the pandemic, but historically, pandemics only end when you get to about 80% immunity. May I have the next slide? So I think it's important, if we're going to be talking about vaccines, I think it's important to do two things. One is to make sure that everyone's on the same page with regards to how vaccines work, but also for us to understand what this novel coronavirus, how it challenges us as humanity. So prior to 2002, there were only 5 known human coronaviruses, and they all produced relatively benign disease in humans. All of them produced something along the lines of common cold symptoms. And it wasn't until 2003 when one of the first coronaviruses leapt from an animal host into a human host, and that was SARS. And then very shortly thereafter, we had MERS, the Middle East Respiratory Syndrome. And then in 2019, of course, this new novel virus jumped from bats to humans. And while the coronaviruses are a huge number of viruses that infect all kinds of living things, these are now the only 8 known viruses. Actually, that's a typo. There's only 4 human coronaviruses. There's 7 total coronaviruses. And as you probably all know, we have no effective vaccines for the common cold. So what makes us think that we can develop a vaccine for this coronavirus and have it be effective? Well, one of the things, and I'll get to it in a future slide, is that there is an effective novel vaccine for MERS. And while most of the coronaviruses mutate rapidly, there is some aspects, the so-called spike protein that allows the coronavirus, the SARS-CoV-2 coronavirus, to enter respiratory cells. That spike protein has been conserved, meaning it's the same in all of the different variations of the SARS-CoV-2 virus to date. So that is the target that virtually every vaccine maker is going after. Can I have the next slide, please? So it's important, I think, and amazing, I think, to look at what has been the timeline for this particular pandemic. So I think everyone remembers back in the second week of December when there was the first initial reports out of Wuhan that there was an outbreak in one of the markets in Wuhan that was a novel respiratory virus that they hadn't seen before. And the time between that and when the full genetic code, the full RNA code of this virus was both determined and then published was only 30 days. Now that turnaround time is nothing short of spectacular. But as fast as science was moving, the virus was moving even faster. So by just a couple weeks after that, by January 26th, we had a report by the World Health Organization that there had so far been 2,794 proven infections in China and 80 deaths. So this virus was moving very rapidly. But so was science. By March 10th, the first human vaccine trial was started. And then on April 10th, famously, Alex Azar announced this Operation Warp Speed, where the federal government in the United States would move at a speed never seen before to develop a vaccine and would put enormous amounts of financial backing behind a number of companies that had promising candidates. Warp speed, of course, being referenced to Star Trek and how they move at faster than the speed of light. This was really incredible because prior to this vaccine effort, the fastest effort to develop a vaccine ever in human history was the mumps vaccine. And that took far more than a year to go from development, from initial development to approval by the FDA of the mumps vaccine. And so to go and discover this novel coronavirus, to decode it genetically, to pick a target for a vaccine candidate, and then to develop a vaccine with phases of clinical trials completion and approval by the FDA in under 9 months is a staggering improvement upon the time that it took to do the mumps vaccine. As of October 12th, when I started putting these slides together, there were 92 vaccines and preclinical trials that actually, since this slide was created, that number has actually increased. And there are 44 vaccines currently in human trials of one phase or another across the globe. But still, the virus in this pandemic continues to move rapidly. And it also, I would say, is moving at warp speed. I think everyone knows that there are more than 37 million confirmed global cases. There's been more than 1 million global deaths. And here in the United States, while we're approaching 8 million cases, we've had 215,000 deaths. These numbers are up a little bit from the 13th as we are continuing to uptick in cases, but also uptick in the rate of growth of cases. Some folks have asked, I think appropriately, that what if we just let the virus run through our communities and develop what's called natural immunity, something along the lines of what Sweden has tried. Well, if you do the numbers, if there have been 7.8 million confirmed cases with 200,000 deaths, we have more than 350 million people in the United States. So if you do that ratio, I think it shows you the staggering amount of death that we would likely incur, if we allowed this virus unchecked to run through our population and we exposed everyone with the hope of developing community immunity. Next slide, please. So I didn't give those numbers appropriate credit. Those are from the Johns Hopkins website. which tracks global COVID-19 infections. And this slide here comes from the excellent website that the New York Times has on vaccine tracking. And you can see here that there are 30 vaccines currently undergoing safety testing in humans. These are small scale tests of 10 to 100 individuals to make sure that there are no safety problems. There are 15 vaccines that are in phase 2 trials. These are larger scale vaccine trials that are also intended to demonstrate safety, up to 1,000 or more individuals. And like many trials of drugs, manufacturers are in certain instances allowed by the FDA to put phase 2 and phase 3 trials together. A number of vaccines that are in phase 2, phase 3. Currently, the Pfizer vaccine, for example, the one trial that we're involved in is in a combined phase 2, phase 3. So there are 11 across the globe in these large-scale efficacy trials, meaning is it effective in preventing the infection? Through phase 1 and phase 2, we learn whether or not it has an ability to generate an immune response and whether or not that immune response is safe in humans. And it's really in phase 3, putting it into the wild, so to speak, that you figure out whether or not it prevents actual infection. And one of the double-edged swords for us in the Pfizer trial was that in the middle of summer, towards the end of July and August, our rate of infection in our community was so low that Pfizer stopped allowing us to enroll patients because they were concerned that there wasn't enough of a risk of those patients to be exposed, and therefore they would be unable to demonstrate any difference between the group getting the vaccine and the group getting the placebo. And sadly, now that our rate of positive cases is increasing, Pfizer has once again begun delivering us doses, and we restarted enrolling patients. There are 6 vaccines that are currently approved for early or limited use. Primarily, these are in the militaries of countries around the world, and there are 0 approved vaccines right now across the globe. So we are racing towards approval through an FDA emergency use authorization. But another interesting thing in this pandemic is how the technology for vaccine development has changed. Can I go to the next slide, please? I think everyone knows that the earliest and first vaccine in human history was the vaccine for smallpox. And famously, Dr. Jenner noted that milkmaids in England who happened to get cowpox seemed to be immune to smallpox. And they came up with this idea of infecting people with cowpox, which had a relatively benign clinical course, and seeing if that would prevent smallpox. And it worked. They didn't know why it worked, but we do know now why it worked is because the smallpox vaccine and the cowpox vaccine share a common set of proteins on its surface. And of course, the concept of vaccines are that if your immune system has been exposed to something, whether it be a virus or a bacteria, it develops a response to that infective agent. And when it's presented again, it can effectively fight it off. And so because the cowpox and the smallpox shared a common envelope around it, it recognized that envelope when subsequently challenged with smallpox, and it was able to prevent infection or at least mitigate the effects of the infection. And that really is the basis. And without getting too much into immunology, there's really 2 kinds of immunity. One kind of immunity is the immunity that develops antibodies. And there's another kind of immunity that's called cellular immunity, where the T cells can attack infected cells within your own body. And it's a complicated set of dance between the T cells and the antibody immunity, but both can be triggered by vaccines, and both can be effective at preventing illness when infected by viruses and bacteria. And so for many years, folks used that concept of either a similar virus, or more commonly, they would take a virus and partially inactivate or kill it. And we know there's lots of examples of these kinds of inactivated or attenuated virus vaccines, such as the rabies virus vaccine, hepatitis A vaccine, or influenza. And this is the course that much of the world is pursuing in vaccine development. And both in China and India, they're in late stages of testing a attenuated, inactivated SARS-CoV-2 COVID-19 virus, and it seems to be quite effective. The challenge with these viruses is while it's relatively straightforward, vaccines, while they're relatively straightforward to create, they're very slow to produce because you need to grow them in massive quantities. And that's one of the reasons why influenza vaccine providers find it difficult to change course late summer in order to get adequate vaccine doses to the market in fall for the United States. There's another kind of relatively commonly produced vaccine where they re-engineer the genetic code and produce large amounts of just the protein envelope around a virus. And there's examples, and this has been a way that producing vaccines for about the last 30 years. So the current hepatitis B vaccine and the shingles vaccine are common examples of this sort of a protein re-engineered vaccine. And while recombinant technology is very well understood, established, and able to work, you still have to engineer a bacteria or something to make the protein and then also grow that over large periods of time, and it is slow to produce. But there are companies, because this is a tried and true process, both Sanofi and Novavax are two companies that are that have clinical trials in humans right now using this technology. The last two here are novel. This viral vector vaccine, which you've, I'm sure, read about, because there are three trials that have been, two trials that have been halted on this. First, the AstraZeneca trial in the United Kingdom, and more recently, the J&J trial in the United States, uses a non-replicating or benign virus, most commonly adenovirus. They manipulate that adenovirus to insert the genetic code for the spike protein in the SARS-CoV-2 virus into it, and they inject that virus that is live but may not be able to replicate into a human, and then that virus uses the molecular machinery of your own body to produce protein, which then produces the immune reaction. There's only one example of one of those vaccines that has previously been approved, and that is the Ebola vaccine that was approved in July of 2020. So this is new technology, relatively unproven. It's exciting that we're using this now. People are concerned, however, that the virus may cause problems. The adenovirus that's used may cause problems or illness in some people. That's why the AstraZeneca trial was studied. It turned out the data monitoring board that was looking at that decided that that was not the problem, so they've restarted that trial. But the other possibility is if the individual is immune to the adenovirus that's used, then that virus will never enter the body's molecular mechanisms. It will never produce the protein, and therefore immunity will not be created. Finally, the most exciting technology and the vaccines that have probably gotten the most press, certainly have gotten the most funding, and have the most promise for us to get an early vaccine candidate are these genetic vaccines. These are either DNA or RNA that are injected as skipping the viral vector, and they also use your own body's molecular mechanisms to make the spike protein, so then you develop immunity to it. So both Moderna and Pfizer use this technology. It's very exciting, but there are no current examples of any vaccine that's ever been successfully produced using this technology. The most important part about this, and the best part about this type of vaccine is it can be produced in a laboratory without having to grow anything in eggs or other kinds of cells, and you can have incredibly rapid production. There are downsides to it, however. It's very difficult to handle in that it needs to be stored at minus 70 degrees Celsius for until just a few hours before it's injected. And so if we are going to vaccinate a large portion of our population, we are going to have a challenge with the distribution of this vaccine. The other challenge for both this vaccine and for the viral vector vaccine is that the majority of them require 2 doses. And if you get a single dose of the AstraZeneca vaccine, the second dose must be of the exact same manufacturer because they're using different technology. So these are some of the challenges and some of the benefits of each one of these. The fifth type of vaccine is a repurposed vaccine like BCG. This is a vaccine that's used in much of the developing world to prevent tuberculosis. But it's been noted that some vaccines have cross-reactivity. I didn't put it on the sheet because I don't think it's going to be commercially viable, but it's just something that is also being pursued. Again, I think the staggering thing here is how fast we have gone from novel virus to vaccine production and testing. Can I have the last slide, please? So what are the conclusions here about vaccines? Well, this development is truly proceeding at warp speed. This is something the likes of human history has never seen. But this pandemic is also proceeding at warp speed. And I think that we are now seeing, particularly in the United States, a rapid resurgence of infections. And I think we absolutely must have a vaccine if we are to prevail. I think that there's been a lot of discussion about which timeline is correct. My answer is I think all of the timelines that you've heard are correct. While it's unlikely that we're going to see anything approved prior to Election Day, I do think it's possible that one of the major candidates, particularly of the genetic material vaccines, the DNA or RNA, I think it's possible that the FDA would approve one of those vaccines under an emergency use authorization. They've demonstrated so far that they're safe. They're getting close to their enrollment numbers. And I think depending on whether or not they're able to show a statistically significant difference between those vaccinated and those getting placebo, they're going to submit that data as soon as they're able to show the 50% threshold that the FDA has asked for. So and if that does happen, if they do get approval at the end of 2020 or at the beginning of 2021, then the race is on for production and distribution, which are going to give us incredible logistical challenges. Every state, as you probably know, was required to submit a plan to the Center for Disease Control about how they're going to prioritize and use the state's infrastructure to deliver and vaccinate individuals. We participated with our own state hospital association, Connecticut Hospital Association, with the other 30 hospitals in the state to give advice to the governor's office in production of that document. And it's going to be very important for us as healthcare providers to have input into how that is going to go. But the logistics of productions, distribution, the supply chain of everything from the cold temperature freezers that are going to be needed to syringes and dilutants is going to be amazing. Amazingly difficult. The other thing that's going to be difficult is maintaining, as I said, consistency for these vaccines that require 2 doses, usually either 21 or 28 days apart. And that means that I think while the approval may come sometime around the start of the new year, I don't think there's any chance we're going to see community immunity before sometime in the middle or towards the end of 2021. And so that's why when you hear vaccine is going to be approved from one group or Robert Redfield say that they're not going to see mass vaccination until summer, both of those answers are probably correct. And the first vaccine approved by the FDA with this 50% efficacy threshold that they're setting is probably not going to be the best vaccine that we ever get, and therefore won't be the final vaccine that we get. There's also been speculation about whether there is going to be genetic shift or drift of the coronavirus over time. We know that using phylogenetic analysis, that there are different strains of this SARS-CoV-2 virus circulating in our communities. And there's been lots of discussion and papers written about how the East Coast received a virus more similar to that circulating in Europe, while the West Coast received a virus that was more similar to that circulating in China. But the core genetic material, and more importantly, the spike protein that is the target for vaccine development, seems to be the same and hasn't shifted. So that gives us hope that we will be getting a vaccine once, and we will not need to be revaccinated for different strains of the virus every year, like we do for influenza. Now, it may be possible that a vaccination needs to get boosted every once in a while, like we do for measles, mumps, rubella, or for tetanus. And that will have to be discovered and decided in long-term follow-up for any of the vaccine candidates. So we're going to be talking about vaccines for a very long time. And we are probably going to see many candidates come and go and many approvals come and go until we find the best vaccine. And then we're going to need to determine how long it confers immunity for and how much time we need to have between boostings. So I covered a lot of ground there, and there probably are some questions. I hope I can answer some of them. So why don't I stop here and see if there are any questions.
Great. Thank you so much, Dr. Balcezak. You know, there's so much that you've gone through, and as our members are starting to really think through how the vaccination process will move forward, one of those first categories of patients or of people who will get the vaccine are those on the front line for staff. Can you share with us a couple of actions, one or two, that Yale New Haven has undertaken to be ready for accepting and administering this COVID-19 vaccine for your staff?
Sure. So I think like all of the hospitals in New Hampshire, you know, we have a mandatory flu vaccine for our employees and throughout the hospitals in the state of Connecticut. And so we've got many years of experience of how to do mass vaccinations. I think the challenges that we're going to have to work through is, first of all, is it going to be mandatory? I'll tell you that it's going to be very hard for us, and we've had some preliminary conversations about this. It's going to be very hard for us to make mandatory a vaccine, which is probably only 50% effective, and we have less than a year under our belt for safety measures. There's a lot of concern about among our staff from our town halls that we've picked up about what is going to be the long-term consequences of the vaccine, if it's an adenovirus or a novel DNA RNA vaccine. You know, I probably myself will choose to get it, but I think at least in the first blush, we are probably not going to make it mandatory, but that's a speculation purely on my part. With regard to who is a frontline worker, with all of the other things that we have done, we have said anybody who has direct patient care is a frontline worker. If you're a custodian and you clean patient rooms, if you're a food service worker and you pass trays, if you're a registration worker and you meet people at the registration desk, we consider all of you frontline workers, and they will have first access to all doses. With regard to the logistics of the vaccine that I referenced, you know, we have since procured and installed these -70-degree freezers. There's intense competition, like there is for testing supplies and drugs right now for those freezers, and it's unfortunate that we don't have a strategy for us to be collaborating nationally on how we can make those distributions more appropriately. So those are some of the initial logistics. We have worked with our suppliers about the access to syringes and other things, and we've been successful in procuring that we'll be able to get those. And we've also used our testing enterprise, our COVID-19 testing enterprise, to practice how we can get into vulnerable communities. We acquired, for example, 3 healthcare vans, really repurposed recreational vehicles, and we've turned them into mobile COVID testing sites. And we've had preliminary conversations with those staffs about how we can get into those inner city neighborhoods in Bridgeport, New Haven, and New London, 3 of the poorest cities in America, and get access to vaccination in a similar way that we've given access to testing.
That's great. Thank you. Just one last question. If you had a piece of advice for our hospitals as they begin their planning for COVID-19 vaccine distribution, what would it be?
I think, you probably all stood up hospital incident command structures during the height of the pandemic. I think using that same structure and putting together a team of infection preventionists, pharmacy individuals, perhaps lab individuals, along with some individuals that can represent the community, and talk about how you're going to do things within your community, both the community of the hospital, but the community that you operate in. I think that would go a long way towards creating a plan that is both outlined by experts, but also has the buy-in of your greater community.
That's great. Thank you. Thank you so much, Dr. Balsasak. We so appreciate you joining us this afternoon and for sharing your insights and perspectives with us. We so much appreciate it.
Thank you very much. Good luck, everyone.
I also want to take this opportunity now to thank all of you, our members, for your leadership, your dedication, and your commitment to the patients and communities you serve, not only today in the face of the COVID-19 pandemic, but every day. Words simply cannot do justice to the challenges you faced or the heroism with which you've responded to this public health crisis. As Bob Stegmeyer noted earlier, while each of you has navigated this path within your own organizations, you are not alone. You are part of a much larger collective of hospitals and healthcare systems convened through the New Hampshire Hospital Association and the Foundation for Healthy Communities. I could not be prouder of the work that we've been able to do together. To my colleagues at the Association and the Foundation, and especially its Granite State Healthcare Coalition, I can't thank you enough for all of your hard work, your ingenuity, and your refusal to give in to the challenges we have and will continue to confront in dealing with this pandemic. And to the NHHA board and our members, and to the Foundation for Healthy Communities board, thank you. Thank you for your active involvement and engagement with us and with one another. You collaborated and partnered with each other, with your community partners, state leaders, and others to make decisions that were in the best interest of your patients and your communities. We spent countless hours working through major policy decisions that have helped inform our work and that continue to this day. Your willingness to collect and share data every day on a number of critical metrics with one another is so vitally important, providing critical situational awareness about the resources that are available and how best to respond to the pandemic. And your insistence that we continue those efforts speaks volumes to your commitment to one another. Your active engagement in the association is what drives our work and what makes our success possible. Frankly, it's what brought the association together 86 years ago. And while we're certainly facing a far bigger challenge today than when those who gathered back in 1934 to create the New Hampshire Hospital Association, I believe that common purpose to improve the health of our patients and communities is stronger today than it's ever been. That commitment has been on full display over these past several months as you've dealt with the pandemic and all of the other things that you continue to deal with every day, from the continued mental health and substance use crises to caring for our most vulnerable populations and so much more. And it will be absolutely essential that we maintain that level of engagement in the weeks and months ahead. We don't yet know what the fall will bring in terms of the pandemic. We've certainly seen an increase in infections and community transmission. And while we don't know what that ultimately will mean for patients needing hospitalizations, we do know that you will be ready and prepared to care for all of your patients. The financial consequences of shutting down elective procedures earlier this year will not go away quickly or easily. We have to make sure that every institution has the resources they need to navigate the pandemic and be able to continue to serve the patients and communities who depend on them. Your resolve and commitment to one another has been so inspiring, and we're going to need all of that and more as we face the financial and operational headwinds in the months ahead. Together, we can accomplish a great deal, and I'm confident, working in that spirit, that we can and will continue to make a difference for your patients and communities in the state of New Hampshire. Now, it is my pleasure to introduce the incoming chair of the Board of Trustees for the New Hampshire Hospital Association, Dr. Don Caruso, President and Chief Executive Officer of Cheshire Medical Center, a member of Dartmouth-Hitchcock Health. Don?
Thank you, Steve. As Steve noted, I'm Don Caruso, President and CEO of Cheshire Medical Center, Dartmouth, Hitchcock, and Keene. I'm pleased to be serving as chairman of the New Hampshire Hospital Association Board of Trustees this year. I want to take this opportunity to thank Bob Stegmeyer for his leadership of the New Hampshire Hospital Association Board over the past year. As leaders, we don't always get to choose the challenges we face, and no doubt that Bob didn't choose to be the chair as the COVID-19 pandemic struck. But we are very appreciative of his leadership of the association this past year. I also want to thank 2 Hospital Association board members for this year's dedicated service, who will be rotating off of the board. Dr. Keith Shute, Senior Vice President and Chief Medical Officer at Androscoggin Valley Hospital, and Sidney McGuire, President and CEO at Monadnock Community Hospital, who also served as a chairman of the association in 2018. Your active involvement and contributions have been instrumental in our work, and we have benefited greatly from your thoughtful participation and leadership on the board. It's also my pleasure to announce the results of the ballot to elect officers and the new members of the NHHA Board of Trustees. In addition to myself, as the incoming chair of the NHHA Board of Trustees, Kevin Donovan, President and CEO of LRG Healthcare, was elected to serve as vice chair of the board. Bob Stegmeyer, President and CEO of Concord Hospital, was elected to serve as immediate past chair of the board, and Dean Carucci, CEO of Portsmouth Regional Hospital, was elected to serve as Secretary-Treasurer of the board. Other members elected to serve on the NHHA board include Dr. Greg Baxter, President of the Elliott Health System, who was elected to serve as the Hospital Association's delegate to the American Hospital Association Regional Policy Board. Art Matheson, President of Memorial Hospital. Mike Peterson, President of Androscoggin Valley Hospital. And John Percillo, CEO of Northeast Rehabilitation Hospital. Members elected to continue their service on the NHHA board include Dr. Neil Meehan, Chief Physician Executive at Exeter Hospital, Dr. Maria Ryan, President and CEO of Cottage Hospital, and Jeremy Roberge, President of Huggins Hospital. We look forward to working with these new members in the coming year, and I also want to thank the rest of the Hospital Association board members for their continued service. There's no question that we have many challenges in the weeks and months ahead, which is why I want to urge your continued involvement and engagement with the association. Our success will be defined not by what each of us does individually, but rather by what we do accomplish together. I am proud of what we've been able to do, from developing data systems that help us and our state partners respond to the pandemic, to developing guidelines around resuming non-urgent elective procedures, to supporting ways to ensure patients have access to visitors and caregivers, to advocating for state and federal relief, and much, much more. We're able to successfully do these things because we work together through the association to make sure that they work for all of our institutions and the patients and communities we serve. That is our resolve, and quite honestly, our responsibility. The challenges ahead will demand it. I'm humbled by the opportunity to serve in this role and pledge my commitment to all of you. We have a terrific team at the association who helps lead our efforts, and I want to express the gratitude and appreciation of the NHHA Board of Trustees and all members across the association for your efforts over the past 8 months, and frankly, over the past 86 years the association has been in existence. You have led with commitment, compassion, and a willingness to collaborate in the best interest of our members, their patients, and the communities that they serve. We thank you and look forward to your continued leadership in the months ahead. As we close this year's virtual annual meeting, I want to again thank the thousands of healthcare heroes who have and continue to stand on the front lines of this pandemic. While we can never fully capture what happens in our institutions every day, today's video was a wonderful glimpse into the incredibly important work you do caring for your patients. And as you heard from political leaders at the state and national levels, your tireless efforts are appreciated in making a difference in the lives of those you serve. On behalf of myself and my colleagues across the Granite State, thank you. I also want to take this moment to express our appreciation to our 2020 sponsors for your support of the annual meeting, and we look forward to bringing you all back to the Omni Mount Washington next year. Your continued partnership is truly valued, and we thank you for joining us this year. And thank you for joining us today for this year's annual meeting. It's unfortunate that we couldn't gather up at the Mount Washington, but we're hopeful we'll be able to gather again in 2021. Today's virtual annual meeting is adjourned.